to begin from that story on the health sector, the health issues that are affecting the counties. I don't know whether we have the voices of people who spoke after the closure of Shalom Hospital. We'll be trying to get them shortly. But the story here is that a baby who happens to be son of a journalist in Machakos County was taken to Shalom Hospital after getting burnt on his hand. He was supposed to be treated, then he was the morphine was administered. It was an overdose, and now it raises questions about Shalom Hospital, which a few weeks ago there was a report of a mother who was giving birth as the nurses watched and were having tea. So have we gotten to the point of
giving birth on the floor?
Yes. Have we gotten to the point of focusing more on business beyond the medical qualifications of the people that we have working in our facilities?
I think what has happened is that there's been a lot of attention, not just on Shalom Hospital. We have challenges with Kenyatta National Hospital. So I think what should be happening is that the Ministry of Health and those that are concerned should begin to ensure that the hospitals have drills. You know, they're supposed to have continuous education. You've got to constantly be able to update yourself and say, this has happened before, this is... So I think what's happening is a continuous training. The fact that a lot of the nurses and the doctors are hopping from hospital to hospital, and so they have very little interaction with even they almost do things mechanically. So I think it's something that has to be like addressed very thoroughly. Because yes, sometimes errors do happen in medical facilities, but I think something as obvious as that, because usually you can see that the child is this size, and you know that the dosage goes by body weight. So immediately, so that is a major lapse professionally.
All right, and Mheshimiwa Buyu, even as we look at this case of Shalom Hospital, there's another story about is it Garsen Hospital, of a nurse who was at work, was drunk, and he's trying to function, is just not possible. I mean, what's happening? Because yes, we know the health function is under the counties. What's happening to this? Did we used to have these issues before? Are they just cropping up because they're being reported?
First of all, I think healthcare is one of the basic services that a citizen would need. And in the gaps where you have few hospitals that are quite far apart, or few health institutions that are far apart, people take advantage and they come up with health institutions that are private, like now Shalom, for example. And because they are also commercial and money-making, they want to employ or take into their employment nurses or health officials who might not ask or demand too much money. Because of that, they will go for mediocre nurses or mediocre personnel, because they will be able to pay them less, and in the end, they make more money. There is no excuse for anybody who wants to run a health institution to employ a nurse who's not fully qualified or a health official who's not qualified. When you take in anybody who's just worked in a hospital, whether they were cleaners or whatever, and you make them be the officials or be the personnel who attends to patients, you have things like this happening. And I think the focus must also be on retraining and also checking. You know, we sort of don't check on what our people are doing in hospitals or other institutions, whether it's education, whether it's in health clinics, so people get away with it. Because
Dr. Alfred Mutua, the governor from Machakos County, was saying that they should clear the patients and everyone leaves and you close the facility. Is surely that the most effective
At what point
solution?
is he doing that? Remember, he's been a governor all this time. This hospital has been in existence in all this time. So when this now happens, then you take drastic actions like close the hospital and clear the patients. Yeah. So what alternative do those patients have? Is there a hospital or a health clinic that they can go to that's nearby, that's more accessible? So why do we wait until things like this happen for us to overreact?
All right, let's take a look at the voices, just before you go, the voices at Shalom Hospital of what the father of the baby, as well as the leaders from KMPDB and the governor had to say in regards to this case. Well, we'll get to those voices shortly so that we hear what the three people have to say. But you've been at the county before, so you've seen how affairs are managed, especially at the Nairobi hospital. But these issues are not unique to Machakos County. You've seen some of them, like you see the report on Kenyatta National Hospital. We've had issues at the Pumwani Maternity Hospital. I mean, how do we get out of this to ensure that when a mother walks into a hospital, they give birth safely and the baby is safe, and when one goes to hospital, they do not lose their lives or get worse because of a mishandling by medical professionals?
Well, I think the jury is out, and it's really worrisome for all of us, and it should be something that should worry a lot of us, and probably some of us will not get worried because anyhow we have medical covers and all that. But for the majority of the population in Kenya, I'm really sad, because were we right really to devolve health, bring the critical function that it is, and has the national government capacity built the counties, so much as to be able to take up some of these roles? If you look at what happened yesterday, you'll just see the usual theatrics of politicians have closed down the hospital. Of course, again, it's a shouting crowd, and and I assure you there is nothing else that you're going to hear out of it. But looking at really the cross-section, across counties, some very critical questions I would want to ask, and I know maybe the Minister for the CS for Health is listening. What is your role? Like in terms of when, for example, you want to stand here and tell us this is the progress in the county of Nairobi, for example, in matters of health, what parameters are you looking at? Are you looking at painting of the hospital? Are you looking at these PR issues that have been able to do ABCD? What exactly are your accountabilities, for example? And it becomes sad because I know at the final arrangement of things, there is all this international pressure about the thresholds that are supposed to be achieved, for example, at the health sector and at the education sector. But who represents the country at those international forums? It is the national government, which will always go there and excuse themselves that, in our country, the health function is devolved. So at the end of the day, there is some element of accountability that is lost. I would want to draw your attention to something called to the management of the county, for example. What can the CES for Health, for example, tell us about the CECs that are managing this critical docket? She doesn't have leeway to appointing or even to have a template of saying at least these are the minimum thresholds of people that are going to be that critical to the management of the health sector. So really, it's not a matter of blaming governors and saying that they probably have not been able to do ABCD, but it's about how well has the national government. Remember, devolution is only how many years old? This is the 6th or 7th year, for example. I mean, at what point did the national government stop doing capacity building on the counties? And I think the biggest part of it is, does the national government, for example, guide? When you come to education, for example, there are thresholds that, for example, as a country, you must spend 6% of your GDP on education. What has the national government guided in terms of how much counties spend on health, so that we stop seeing all these issues of buying water tanks, of painting a hospital, and then we imagine that we are improving the health sector? It is not working.
Let's listen to those voices now, because we have them.
They killed my son. I need justice. I'm wondering, kulikuwa na issue ingine juzi at the same hospital. I thought wamebadilisha, but sikujali nikileta mtoto for simple dressing ya mkono. Walikuwa wanamdunga dawa ya nini, wanasema wana relieve pain. Which pain? Mtoto alikuwa anacheza. It means mtoto wako ana pain. The two wale walihusika waliua mtoto wangu. That is what I know.
Watu wa KMDPU wanakuja hapa. Tunataka kuambia bwana Dr. Yumbia na wenzake hiyo hospitali ifungwe until such a time that they will convince Kenyans that this hospital will deliver quality services.
Could we just say that what is happening, and that's really, really painful, because for a parent to lose a child in such a manner, it is really painful. But this is just Shalom. But Shalom mirrors what is happening countrywide. There are so many cases where we have mediocrity like this, and people lose their lives, whether they're babies or adults. They lose their lives when they don't need to lose their lives, just out of sheer negligence or sheer lack of...
The other question would be, then who is to blame? Because there's a blame game going on, ladies. You look at what you were mentioning earlier, and experts will tell you we had a revised guideline in terms of our medical facility back in 2016. For example, the guideline to require to complete documentation for every admitted child. So you know how much a child weighs and what percentage to give them. In this case, it was morphine. But then this leads me to my next question, because a number of these children, according to this study that was done, some babies even have to share incubators. And then, which begs to ask the question, what happens to First Lady Margaret Kenyatta's Beyond Zero campaign, whose main purpose is to address this issue? Why the blame game at the expense of our children?
I think we have structures in this country on how the management of the health system should be. There is also policies and guidelines that are constantly given. There is nothing wrong with the guidelines. They're actually very good when you read them. The problem, the challenge that we are having is that people are not implementing those guidelines. So as a country, and believe me, running a hospital comes down to the actual manager of the hospital. The Ministry of Health may give the guidelines, they may deploy the staff, ensure that they are properly resourced. The governor will do the same thing. But at the end of the day, you have to tell yourself who is in charge in that county, who is licensing these private hospitals, and who continuously checks that they are following the guidelines. Then there is also the aspect where it's the public hospitals. Then you look, and as Mheshimiwa Buyu says, what happened in Shalom mirrors what happens in the country. I mean, it broke my heart listening to that father talk about his child, and my heart goes out to them. But the question is, there's many cases like that, because you were lucky that it came out into the limelight, but that is happening all the time. So we should be able to call out to account who licensed this hospital, who is the one inspecting it constantly to ensure that it's following those guidelines, who is checking the statistics of how many deaths that we have accidentally or wrongly, or deaths that should have been prevented that are happening. Those figures should be coming out and constantly monitored, so that Shalom should have been probably shut down long time before.
Yeah, and Janet, even as you jump into the conversation, perhaps we could also link the fact that the World Health Organization say that women who come from poor backgrounds have a higher chance of pre- and post-newborn birth deaths. So we can even link the economic ability of a woman to her attaining proper health care. So could we just also discuss how those two link?
Yeah, and of course, and where the matter hits the masses, and especially, you know, when you're talking about the poorest of the poor, that is where I really get to interrogate the role of the institutions that represent the masses. For example, in every particular county, there are county assemblies, and there's an entire committee of health, you know, for example. And in Senate, you know, Senate oversights really what happens in counties. But really, what exactly have been the roles? You know, because the only thing that we've been seeing Senate pronounce itself on is in matters finance, you know, in matters money. The governor has misappropriated money here and there. But I think in terms of being proactive, in terms of ensuring that what manner of audits can we do to ensure that the citizens get the quality services? What manner of pressure can we put, you know, on counties, for example? I'm expecting, you know, for example, interesting reports from Senate, you know, and a committee of health, because the only time we saw the Senate committee coming in is when there was a problem in Pumwani. And I can bet you the County Assembly of Machakos will go to that hospital, you know, do a few things. And I'm like, really? Let us not blame the governors only. There is an entire arrangement of institutions that should have come to cover all of us, you know, from the problem that we are currently facing.
Indeed, like you say, prenatal care, if you have appropriate prenatal care, that sort of reduces the chances of having issues or problems at birth for the mother and the babies. Because if there's an issue, one is able to arrest it in time and deal with it. And it is also true that the less advantaged people in the society sort of don't have time to visit these prenatal clinics all the time, because 70% of their time they're busy trying to just survive or looking for means to survive. And for many of them, they also don't have that awareness that you need to go for prenatal classes or prenatal visits to sort of cushion yourself against what might happen later. You know, so there's that lack of information, but there's also poverty and struggle to survive, stopping women from making prenatal visits all the time. So indeed, when issues arise, especially the premature births, then the mothers who haven't had prenatal visits.
So what are the solutions? We know the problems, poor management, they say the issue of facilities and poor care yet there's money that's always accounted for that as well in terms of budget. So what are the solutions then moving
We
forward?
expect the Ministry of Health today and the Health Committee should be able to come up with a statement on the action they will take to ensure that this does not happen again. And they should be able to give a status report to the country and evaluate. You should ask and you can do that easily by asking hospitals to report the deaths, the cause of death, the accidental deaths. Because when that is brought to play, you may realize that there's actually had been a higher number, but was never reported. So we should be hearing a clear statement, and not just for the optics for this week because it's on the headlines, but a long-term plan that is sustainable and continuous to ensure that every day we continue to improve our health facilities.
Look at what you're saying about babies sharing incubators. And then the government comes up with equipment and forces it down the throats of the county governments to pay for them.